Hi everyone, this is Dr. Sophie Beecher from You Smile Family Dental Practice. If you're wondering why I'm so awkwardly perched, it's because today the video is not really about me. We're going to be talking about various things to clean your teeth. Okay, so toothbrushes, floss, super floss, water flossers, all of the things that are out there to help you achieve a healthy mouth. Okay, so I'm going to just slide over here. So say hello to my jaws. Hello. So the first thing we're going to talk about are the different types of toothbrushes out there. So you want to make sure you're using a soft toothbrush first and foremost. Now for the Jamaican population, we like things extra clean. So you'll find that patients will gravitate to the harder toothbrushes. And what the medium and the hard do is that they damage the areas by the necks of the teeth, and they also damage the gums, so that the gums will end up receding and you'll have a lot of problems with sensitivity. So since we're in the technological age, everybody knows about the manual toothbrush, but I tell my patients that want a cleaner feel that they can go for a power toothbrush or a spin brush. So this one is the Colgate 360. It's being sold on the market for like 2,000 plus tax, right? At some pharmacies in Kingston. I don't know about the wide availability. And it's pretty nifty. You just hit the power button, right? And it basically does the work. So you just hold it in place and go around, and it basically does the work for you, okay? So you're not exerting too much force on the teeth, right? And you can just go around gently with it, okay? Right. So you also have the more expensive spin brushes, like Oral-B has them as well. They're all good. Just find one that works for you. Personally, I still use a manual toothbrush because I like them. They get the job done well, and I have the dexterity to brush properly. But for my patients that have issues with their wrists, like the rheumatoid arthritis patients, or my elderly patients, or even children, because it's, you know, it's like a gimmick for them, so it's a little bit more exciting, so they'll be easier to comply with brushing. So I tend to recommend those quite a bit for those subsets of people. Right, so have a very old spin brush here, right? Oral-B spin brush is what it looks like. So the next thing we're going to talk about, oh, also, when you're brushing, let me just point out, so a lot of people refuse to take out their wisdom teeth. So there's a technique you can use. You can close all the way so that you get access to the teeth more at the back. And if you use a toothbrush with a smaller head, you can cover the wisdom teeth in a lot of patients. Some of you just, quite frankly, just need to take them out, okay? So before I go on to my flossers, this is my kitty's toothbrush, okay? This is one of them. Of course, it's supposed to be soft. They have the different head sizes for the different age ranges. So this is for 2 to 4, okay? And for the kids, you want to make sure you're monitoring their brushing until they can tie their shoelaces properly, okay? So you can allow them to brush first. It's great. Get them in the habit of brushing. And for kids, we don't really focus that much on technique, you know. You just tell them to start in one spot. Make sure they cover one area first, right? So if you're brushing the top on the right hand side, you do everything on the right hand side. Or you can brush all of the outside, right? And go all the way around. And then you go on the inside and go all the way around. And then I tell them, you know, you count the surfaces of the teeth. So the back teeth, they have 3 surfaces. The side to the cheek, that's 1. The side to the top, that's 2. And then, yes, open wide. Okay, then the inside surface. So you make sure that you're covering all of them. And then as the parent, especially at night, you want to make sure that you are monitoring them. Right? So you go and you look and you brush again, that kind of stuff. So that's the toothbrushes. So we're going to go on to floss. Something so simple and people just don't use it. Alright, so ideally, flossing once a day. Alright, my model here has a little bridge that likes to come off, so we're going to put that one side. Okay. Let's see if I can demonstrate this flossing without this model. Okay, that's fine. So So wrap the floss around, right? Some people say, oh, get it around the 2 fingers and use the 3rd finger, or get it around the 3rd fingers and use... Listen, wrap the floss around, get a steady grip on it. Want to make sure you're going all the... Oh no, you can't floss my model's teeth. Oh dear. No. Let's see if we can floss the baby's teeth. Yeah, that didn't double check on that. And I can't floss. Okay, here we go. You go all the way down in between on one side, and you go all the way down in between on the other side. Okay? You want to make sure that you floss all the teeth. There's a very funny little saying that's up on an office door from a friend of mine that says, you don't have to floss all the teeth, just the ones you want to keep. Right, so moving on to the fancier things now. If you have gum disease, a lot of times you will lose gum tissue, so you'll have larger spaces between the teeth that the floss can't get into, right? Also for my patients that they may have bridge work, right? Or you may have, you know, wherever you have larger spaces around the teeth. This thing here looks like a little bottle cleaner. It's called a proxy brush, okay? And all you do, you just getting it in between the spaces. Recommend it a lot for my patients with gum disease. You just getting in between the larger spaces and it takes out the food quite well, okay? So that's a proxy brush. They're sold in most pharmacies. In terms of availability, I've seen them in Lee's Pharmacy, Monarch Pharmacy. I sell them at my offices, and also you can find them online, okay? So this is called a floss threader, okay? Looks like a little needle and you just thread the floss through. And again, it helps you if you have bridge work, okay? It helps you get under there. So I'm gonna just show you. Just gonna thread it under, right? Or if you have your retainers for the braces, my patients that don't like to clean under their retainers, right? You just thread it through. Oops. Right. Oh, there. Sorry, there you go. And you just go up under it, okay? For my patients that have the bridges though, because the floss is a little thin, I may want to recommend something else to them that's a little bit bigger called the super floss. So this is super floss here. Availability is not that great. So it has this little fluffy part here, okay, and what it does is that it helps to get a lot of the food out. So again, just gonna pass it in between, right? Just thread it through and go up and down. Hopefully you're seeing, right? On either side. Oh, here's my bridge. There we go. So showing you an example with an implant bridge here. So I'm gonna just go and it passes right under. You can see that. So it just takes the food out right there. Woo! Flossed off my bridge. That's okay. Alright, so those are all of the interdental aids. That's what we call them. Alright, so this here is a water pick, which I'm not going to demonstrate for very obvious reasons. Okay, or generically they're known as water flossers. Okay, so the brand is water pick. And what it does is that, again, it's very useful for patients who have braces, but patients who have bridge work as well, patients who have hard to reach areas, patients who they don't want to floss, but you just have to give them something to help them. So all it does is that it sprays jets of water, okay, and that helps to flush out the food between the teeth. Personally, I still prefer my manual floss, okay? And normally it comes with different tips, okay? Different tips. I don't know if you could see the different tips properly. Okay, so it normally comes with a wide range of tips. And as I said, they're very useful for patients that have braces, stuff like that. Okay, so that's basically it in a nutshell for how to clean between your teeth. So there's so many products on the market now, literally you have no excuse, okay? And remember, After you wear your gloves, take them off and discard them properly. Okay, single use only. Don't wear them to the supermarket, please. Okay, bye.